Good morning, everybody. My name is Shannon Etcheverry. I'm the director of the Turner Senior Wellness Program with U of M Health, the Department of Community Health Services. I'm here today for one of our healthy living presentations. We have Dr. Larson here, who's going to be talking to us about pollen sensitivity and health risks for older adults. A couple housekeeping things. We will be recording this program and it will be available in about a week, so mid-December, on the Turner Senior Wellness Program website, and I will put that in the chat. But the address is mishmed.org/TSWP if you want to find us there. So we are having a webinar format today. So that means that those of you who are watching live, you can ask questions in the Q&A box at the bottom of your screen. So Dr. Larson has said that he's more than comfortable with taking questions during the presentation. So please put them in there. Would love this to be interactive, or if you'd prefer, we can answer some questions at the end as well. You will see on your screen that you do have the option to show captions as well. So with that, I will pass it over to Dr. Larson, and thank you so much for being with us today.
Thank you so much for having me. It's really great to be here. I'm going to attempt to share my screen. While we're doing that, my name is Pete Larson. I am an epidemiologist based here at the University of Michigan in the School of Public Health. I mostly do work on environmental impacts on health, and one of those types of impacts, is pollen, which I've done some work on. So I'm really excited to talk to you today and share some of our work. Do you see my PowerPoint?
Yes, I can.
Okay, do you still see it?
Looks great.
Okay, great. Okay, cool. All right, I'm Pete Larson, PhD. I'm at the Department of Epidemiology at School of Public Health at the University of Michigan, and I'm going to be talking today about pollen health and how climate change might be increasing risks, with a focus on aging specifically. So pollen. I myself have pretty intense pollen sensitivities, especially in the spring months and towards the fall. It's not uncommon for people who live here in Michigan to have sensitivities to pollens, because we live in a state that has lots and lots of trees, and plenty of rain, and defined seasons. So I'm going to be talking a little bit about pollens in general, how pollens impact health, and then I'm going to talk about some work we did with our research group on pollen and health. So what are pollens? Great question. I think we all kind of know what pollens are. We know that pollen is kind of the dust that plants produce, that bees like to come and grab, and then they make honey out of it. They are microscopic particles made by flowering plants, trees, grasses, and weeds, and they are spread to facilitate reproduction among plants. Plants, just like mammals, have males and females, and pollen is a way they sort of talk to one another and reproduce. So certain times of the year are what we would essentially call like the breeding season, the time of the year when plants need to reproduce, and that can vary by plant species. And during those types of seasons, the pollen intensity in the air, what we experience, becomes more. And for people without pollen sensitivities, that's really not a problem at all. But for people like me that do have pollen sensitivities, it can be very, very uncomfortable. So what are pollen allergies? This is sort of the big question. We know that pollens are out there, but what are the exact sort of mechanisms that lead certain people to feel really terrible during pollen seasons? Pollen allergies are essentially an overreaction of the immune system to plant pollen. So this is kind of somewhat similar to something like where you cut yourself, like you have a small cut on your hand or whatever. And you'll notice that that cut ends up turning red and gets a little bit swollen. That's an immune reaction that your body is waging to some kind of what we call an insult. There's some wound that goes on, and so the body starts to set up this plan of attack to deal with it. So what happens then is your body produces antibodies, and these antibodies trigger inflammation. And that inflammation can occur in the skin, it can occur in the eyes. Like some of you might get itchy eyes during pollen season. That's exactly what's going on. There's inflammation to the tissues around the eyes. It can also be in the nasal cavity, which can stimulate mucus production. So like when you experience, if you have pollen sensitivities, maybe you get a runny nose and that kind of thing. That's an immune response that your body is setting up to deal with what it perceives to be a harmful invader. And it can also impact the lungs and airways. So, for example, like people have serious, very, very serious sensitivities. You know, their throat will essentially start to close up a little bit, and that can lead to things like coughing and wheezing and generally speaking, feeling really terrible. These problems can worsen in people who have asthma, chronic asthma, or COPD, some sort of lung problem. Pollens can make those problems significantly worse for all the reasons you expect. You have something, you know, in your respiratory system that's compromised, and any sort of immune reaction or inflammation that happens in those systems will sort of make everything worse. So this, you know, graphic over here tells us what I think a lot of us know, because I'm assuming that a lot of people who are watching this are probably watching this because they want to know more about pollen because they have pollen allergies. So things like breathing, some people can experience like hives and skin sorts of things, sneezing, running nose, very watery eyes. In rare cases, nausea, vomiting, diarrhea, and just general swelling of the face are quite common, other common reactions. So, question is, why are some people more sensitive than others? One big indicator is genetics. So if your parents, for example, were pollen sensitive, one or both of your parents were pollen sensitive, you're fairly likely to be pollen sensitive yourself. These things are sort of passed down. You notice that some people are not, or simply not, and I'm honestly very jealous of those people. And part of that is because they just do not have this sort of genetic susceptibility to reacting to pollens. I have to say, I have to point out that pollens in and of themselves are benign. They're really harmless particles that don't really do anything to human health, unlike things like bacteria or viruses, which might, you know, do something damaging to your body. Pollens are not like that. Pollen sensitivities, however, that lead to this immune inflammatory response is where the problem lies. The pollens themselves don't pose a significant threat to our health, but our reactions to them do, if that makes any sense. Some immune systems in some people react more strongly to different proteins on these pollens. And this partly explains why some people are more or less susceptible, because you can be more sensitive to more types of proteins, but also sensitive to different types of pollens, because every pollen is different. And we'll get into that in a little bit. For people who have existing lung conditions like asthma, COPD, chronic bronchitis, these things can increase your sensitivity to pollens in general. Already, your body is primed to react when something goes wrong because you have a chronic condition of some kind, and pollen is sort of the extra, you know, straw that, you know, broke the camel's back, so to speak. It's sort of the extra thing that sort of pushes you over the edge and can lead to like significant exacerbations in the symptoms of those chronic conditions. Environmental exposures, like what people are exposed to over the life course, makes a difference in how people react specifically to pollens. So smokers, for example, can have intense more intense sensitivity to pollens because again, they've sort of compromised, the lining and the tissues of their lungs, and that leaves things more open to adverse outcomes. Um, Environmental exposures, people work in factories and exposed to not the best air quality during their work lives, or exposures to molds. This is particularly a serious issue in places like Detroit, which experience flooding on a regular basis. And so people in their basements, they have a constant sort of, mold exposure going on that wafts up into living areas and can do things like create asthma, but also increase susceptibility to things like pollens. And very salient, important to this presentation, this community, age. Sensitivities can increase with age as lungs and defenses weaken. And I myself, I've noticed that my allergies are significantly worse now than they were when I was much younger. There are sex differences in pollen sensitivity. Um, Women tend to be somewhat more sensitive to different types of pollens than men. And that is because of the different sort of hormonal profiles that exist between men and women. Um, Women in general mount stronger immune responses in general, and pollen is no exception. Pollen allergies in and of themselves are a result of immune responses and inflammation, and in women who have these particular types of hormonal profiles, these sensitivities can get significantly worse. So if for example, you've noticed, or other people around you have noticed that women have are more sensitive or whatever. It's not anybody's imagination. This is actually a real thing. Just want to get that out there. If you're a woman and you feel like you're more sensitive to pollens than your partner or whatever, that's probably a very real thing. There's also differences in asthma patterns. Boys have more asthma in childhood. Women have more adult onset asthma. And so that sort of different trajectory can lead to different types of sensitivities between those two sex groups. Occupational behavior exposure, your outdoor work and what you've done may differ by gender. For example, things like landscaping and out farming, lawn care, these kinds of things are, typically done more often by men. And so they're more exposed to things like grass pollens than women would be. I'm not saying that women can't, don't, or shouldn't do those jobs. I'm not saying that at all. I'm saying in general, we see sex differences by occupational group, and that leads to differences in pollen exposure and ultimately pollen sensitivities. And finally, airway biology. Men and women differ not only in terms of overall size. In general, men are somewhat larger than women, but also in terms of the size of our internal body parts. So women have smaller airways in general than men do, and the smaller airway can exacerbate symptoms because there's just simply less space for air to flow. And when you experience a pollen reaction, your airway closes slightly, so there's even less space for air to flow down. So again, these sex differences are not anybody's imagination. These are very real things based on very real and significant differences between the biology of these two sex groups. And also, I'm not sure that I get into this in later slides, but there's also some racial differences in terms of pollen sensitivities. Non-Hispanic white people are more likely than any other group to have sensitivity to pollen. There's debate out there on why this is. It could be somewhat of a genetic predisposition to sensitivity to pollens based on our sort of continental origin. Non-Hispanic Black people, for example, are less pollen sensitive, we think, than white people, and our pollen, or sort of vegetation profiles in like Africa versus Europe are very different, and that could have led to some sort of, genetic predisposition like hundreds of thousands of years ago. We don't know. I will say to this issue of race and pollen sensitivity that Black people health is commonly understudied in a lot of ways. So this number could be somewhat misleading. Certainly there are lots and lots of Black people that have pollen sensitivities out there. And like we know from health studies, like all over the place, there tends to be an undercount of African Americans in health studies in general, and in terms of what's reported and diagnosed by the health system. So maybe this reflects a very real difference in pollen sensitivities between race groups, but it could also represent the sort of typical structural differences between how these two groups are treated throughout the healthcare system. So I just want to get that out there. I don't want anybody to go home and be like, you know, um, take. I don't want to take people to take home things without getting the sort of caveats to them. Arguably, for anyone with pollen sensitivity, it doesn't matter if they're white or Black or whoever, men or women, it's very real and very serious to that person who has pollen sensitivities. Okay. How pollen sensitivity changes with age. As we get older, your immune system shifts. I mean, just like aging of any part of the physical body, your body tends to body's ability to react to certain things and repair itself declines with age. This is well known. The immune system is no exception to this. Your ability to wage an immune response against some type of pathogenic invader becomes less with age, and also your types of immune response, the term inflammatory response, tends to get more intense. There's also the issue of as one ages, your risk of having various chronic condition increases. And so, we see these increased pollen sensitivity in older age groups because there's like baseline chronic conditions that many old people have, things like asthma, for example, COPD, heart-lung interactions. All of these things can work together to worsen pollen effects. Here's a little graphic here that I think is interesting. Human body changes in many ways as we age. Allergies are no exception. Some people develop allergies as they get older, even if they never had them. This is very common. Others, oddly, outgrow their allergies. Some people say their allergies disappear, and there's really no clear explanation as to why that is, but it does happen. Yeah, so once you have an allergy diagnosis, and this is kind of like sort of my take-home message with any of these public health presentations, is the more you know, the more you're able to do self-care for whatever condition you have. It's important to get tested for allergies if you can think at all that you have some kind of sensitivity, even if you sort of have never been told that in your entire life. It makes sense to go get a panel, to go to like an allergist and get tested for your sensitivity to specific types of pollens, so that you can rule out, if you don't have sensitivities, you could rule that out as a source of whatever respiratory problems you might have. And if you do, then you can do things to protect yourself, from those types of pollens when they are extremely prevalent in the environment. So the more you know, the more you can take charge of your health. Speaking to that, I was not aware that I had pollen sensitivities until I was nearly 50 years old, which seems kind of crazy. Every summer in August, I would feel really, really awful, and have runny nose, sore throat, and my eyes would itch. And I never put it together that was a pollen allergy. I just thought I was getting a cold every summer. And then I started working on this pollen and health project, and I looked at the symptoms, and I was like, oh, that's me. That's exactly me. And so now I'm much more aware of it, and I mean, honestly, there's not a whole lot I do to protect myself from pollens because I live in the country and there's not a lot I can do. But I know to do things like, take Claritin, for example, and sort of like run to the city when things are really bad. Does anyone have any questions? Happy to take questions along the way.
I don't see any yet. Thank you.
Okay, and let's move on. So, moving on with this pollen sensitivity and age, airway changes. Older airways are less elastic and more prone to inflammation. Your airways are essentially a tissue muscle group, and just like any other sort of tissue and muscle group in your body, becomes less elastic, and easier to hurt. Um, Slower recovery, inflammation from pollen takes longer to resolve as you get older, and medication interactions. So certain medications that people might take might increase airway sensitivity, in general. So um, plenty of things to be aware of. And if you suspect that you have allergies, it's important to let your physician know, so that they can be aware of what medications they're prescribing you and be aware that it might be exacerbating your allergy symptoms. So this is an important question that people ask often. Um, people, just general people, tend to view pollens as all the same. They're very much not. Um, People are sensitive to different types of pollens. Different plants make different proteins, and each of the type of those proteins has a different allergenic signature, whatever identifies it. And that's what your body uses to set up an immune response. It identifies a type of protein. It says, oh, this protein is a threat, and then sends out the troops to go deal with that particular protein. It's basically like, the pollen comes in with a set of calling cards, and your body looks at all those calling cards and sees whether this is like, an evil invader or not. And if it finds one, then it sends out the police to go deal with it. Most people who have pollen allergies react to only specific species of plant pollens, not all of them. It's very unusual for a person to be sensitive to every single type of pollen that's out there. Some people are sensitive to ragweed. Some people are sensitive to grass. Some people are sensitive to trees and grass. There's all different kinds out there, and it really depends on what types of proteins are on those particular types of pollens. Cross-reactivity can happen. Some pollen types share similar proteins, so being allergic to one may make you react to related species. Like, for example, a birch allergy may make you react to an alder or an oak tree pollen. And geography matters. So where you live and where you were raised and what you've been exposed to over the life course really matters in terms of determining which pollens you'll become sensitive to later. So, for example, it is well known, well, not well known, I think it's still somewhat slightly controversial, that early childhood exposures to different types of allergens will predict whether they're allergic to those things as adults or not. Sometimes, in some cases, an exposure to those kinds of allergens early in life can lead to a protective effect. So, they were exposed to it at a certain age of their life. This is kind of like vaccines. You want to give them at a certain age at their life because their immune systems are primed to do different things at different points throughout their childhood. Also, not exposed to different things can lead to greater sensitivities later because you're just not primed to react to that. Or the opposite can happen. There's all different kinds of things that can happen. But since plant species differ by location, your exposure to different types of pollens can differ. So I think this is a really important question. We know that pollen allergies and the experience of an immune response is really terrible, not fun. But the question is like, yes, we have a runny nose and itchy eyes and all these things, but do pollen sensitivities impact our mental health? And this is a question that myself and some colleagues were interested in, is whether pollens can do things like increase like depression, for example. Pollen allergies can increase inflammation, which can influence mood regulating pathways. So, for example, like if you have a back pain, for example, a back pain will literally ruin every aspect of your life. You're not happy. Your back hurts. You have pain. And it's really hard to be like maintain a sort of like happy disposition when you're experiencing all that kinds of pain. Pollen allergies and the inflammatory response, while not necessarily being extremely painful, are still an inflammatory response. And that inflammatory response is leading to changes in mood. So, um, people, when they have an allergic reaction to pollens, they also sleep poorly. And we all know that if you don't sleep well, you're generally not very happy during the day. So, uh, pollen allergies in general have been linked to increases in stress and anxiety and depression. And I think that's something really worth knowing. If you have pollen sensitivities, perhaps it's not so physically uncomfortable that you really want to do a whole lot about it, but it could be significantly impacting your mental health without you even really being aware of it. So it's important to sort of get this checked out and see your doctor and have a discussion about that if you feel that might be going on. So large studies show higher depression scores on high pollen days. So we measure the amount of pollen through things like monitors and that kind of thing. And what researchers have found is that people who are in the midst of a extremely high pollen event tend to score higher on depression measures. Some people, and maybe some of you know, experience cognitive fog or difficulty concentrating during pollen season. I know this when it's really bad. I have a really hard time focusing on things. You just get with this like brain fog. And people with asthma or chronic issues may experience heightened fear and worry during severe allergy periods, because anyone with asthma knows that an asthma attack can be extremely traumatic. And if you're in a high pollen environment and you're feeling the effects of pollen, your pollen allergies and sensitivities, people with asthma express like increased worry that they might have an attack during those periods. So we did a paper a few years ago with my colleagues, Rachel Bergmans, Brianna Mezek from the School of Public Health, Karina Grinland from the Institute of Social Research, and Allison Steiner from the College of Engineering, asking the question, does short-term exposure to atmospheric evergreen, deciduous grass, and ragweed allergens and the risk increase or impact the risk of suicide in Ohio? And with this research, we didn't find any sort of clear associations, but these associations are somewhat hard to track. But we did find differences by gender, which were supported by other research that suggests that increased pollen sensitivities among women are also associated with increased risk for depressive events. So somewhat of a grim study, but I think important to know, especially if we're trying to, identify people who might be at risk for extreme mental health events. I think I said all that. Okay, so this is important for us here in Michigan. We have different types of pollens in Michigan. Michigan is a very diverse state. We have lots of rural expanse that we know and love, and we have well-defined seasons throughout the year. So we have things like tree pollens. These are all your sort of deciduous broadleaf pollens, oak, birch, maple, ash, elm, poplar, and sycamore. These are sort of like your hardwood trees that you see throughout Michigan. We also have evergreens that pollens that come out in late spring. And these are your pines, spruces, and cedars, juniper plants. And then because it can't ever be enough. We have grass pollens that come in late spring, early summer, as everything gets wetter and warmer. And then, just to make things worse, we have weed pollens late in the summer and early fall, ragweed being a very common allergen throughout the world. Michigan has multiple overlapping pollen seasons, which is absolutely wonderful for people who have sensitivities to two or more of those types of pollens. You go through one season and all of a sudden you're in the next one. So it feels kind of never ending for people who have sensitivities to multiple types of pollens. So just to give you an idea of the sort of geographic variation in exposure to these different types of pollens, I have 4 plots here. This is a map of Michigan, Ohio, and Pennsylvania. And there's evergreen, deciduous broadleaf, grass, and ragweed. These are all our sort of common culprits. And you can see that the geographic distribution of these different types of pollens is somewhat different. So for example, here in evergreens, we have a lot in the UP. As you know, if you've ever been up there, lots of pines up there, pines and cedars, lots here around the thumb, and then sporadic around Ohio and Pennsylvania. Deciduous broadleaf follows a somewhat similar pattern. This sort of represents like, forest land in general. But grass tends to be lower in Michigan than in warmer, more southern climates like in Ohio and Pennsylvania. But ragweed is extremely serious here, especially in the western part of the state, and somewhat here in down by Detroit, south of Detroit, and over in eastern Pennsylvania, but not so much in Ohio. So if you have ragweed sensitivities and you live like in Grand Rapids, I feel really bad for you. It's quite serious out there. Washtenaw County, we tend to have the worst of every world, I think, in many ways. We're kind of like a rural, somewhat agricultural county, but we're also sort of nestled, in between these sort of like east and west patterns in many ways. Okay, so now I want to talk about some work that we did with colleagues here at the University of Michigan, myself, Allison Steiner from the College of Engineering, Marie O'Neill from Environmental Health Sciences and the School of Public Health at the University of Michigan, Alan P. Baptist, who is now at Henry Ford, but was the chief, that was the head of the allergy clinic here at the University of Michigan, and Karina Grunland, who is at the Institute of Social Research. And we were looking at chronic and infectious respiratory mortality and short-term exposures to 4 types of pollen taxa in older adults in Michigan from 2006 to 2017. Okay, what do we know? We know that pollen is bad for some people. But we also know, disturbingly enough, is that climate change, the world is warming, is leading to lengthened and more intense pollen seasons. So, for example, a ragweed season in the deep summer, at the end when it's very hot, that hot period is getting hotter, and that hot period is getting longer. And so what that's leading to is longer exposure over time to that particular type of pollen, and in the middle, more intense exposure. So we're getting it both ways. Pollens, as we said before, can trigger or worsen chronic and infectious respiratory conditions, especially in older adults, which is the focus of this paper and this work. And also, not only the temperature, but also the increased level of carbon dioxide in the atmosphere is leading to plants to release more pollens, because plants in general use temperature and carbon monoxide presence as triggers that signal them to release pollens at certain times. More CO2 is leading to trees releasing more and more pollens, heat making it more intense, and the longer, warmer season making it longer. So we're just getting it, every way. Most prior work is focused on symptoms, hospital visits, or single pollen types, not specifically mortality. I don't mean to get grim with this work at all. But we're trying to protect the public health and keep people as healthy as they possibly can. So we focused in this project on mortality, because mortality is a defined event. We can measure that event. We know when it happens. And the state of Michigan, for example, keeps very, very nice public records on that. The key gap is the limited evidence on short-term lagged effects of different pollen taxa on cause-specific respiratory mortality. So what that means is you have an overall exposure every year to different types of pollens, but our question was, does your exposure to that level of that type of pollen on that day increase your risk for mortality from a respiratory event of some kind? And does exposure 2 weeks before or 10 days before or a week before increase that risk? And what is the exact timing of that? So we're not only looking at sort of broad patterns, we're looking at very specific patterns. What is the timing of exposure and the timing of this outcome? And we wanted to do that for all 4 pollen types to get a handle on what the individual effects of all these different types of pollen was, and also looking at differences by sex and race. Okay, so how do we do this study? We contacted the Michigan Department of Health and Human Services, and we received data from their vital records, basically all the death records. And in those death records, there's information on the cause of death, whatever they died from. There's 18 different fields in the Michigan death records where a physician can record all of the contributing causes of death for each person. And so we can look at those codes and figure out who died from lung or breathing problems between this window of 2006 and 2017. We were looking at general respiratory, but we were also looking at things like chronic lung disease, COPD, emphysema, and also infectious respiratory problems like influenza or pneumonia. We also got through this data set that Allison Snyder and the College of Engineering created. We got measures of pollen in the air for every day for 4 different types of pollen. And so we were able to take that date of death that's listed on that death record, assess that exposure on that particular day, and each of the 14 or 21 days preceding that date. So we know not only what the exposure was on the day they passed, but also their exposure history over the past previous weeks. For each person, we looked at pollen levels on the day they passed and all the 14 days before, and then we compared those levels to other similar days when they were alive. So this is kind of a unique kind of study where we're comparing the person on the day they passed to all the other days when they were still alive. The assumption being that that this is such a serious exposure, and on those days maybe they passed, like exposure was really intense, and we're going to be able to catch that signal by comparing to all the other days when they were still alive. We compared days with high pollen, very, very high pollen, top 10%, to days with no pollen, and whether results were different for men versus women and for Black versus white. So we talked a little bit about pollen and overlapping seasons. The first thing we looked at was sort of characterizing what are the yearly patterns of these different 4 pollen types. And so this is a graph, and all 4 of these graphs are the different 4 pollen types that we looked at. And it goes from 0 all the way up to 365. So this is a full year of daily data. So what we see is 0, January 1st. Nothing because it's winter, it's cold, and plants are not producing pollen because it's too cold. But then when spring hits, about like the 90th day or so, this deciduous broadleaf pollen starts creeping up, and then wanes about early summer, early midsummer or so. Same is true with evergreen, goes up and then kind of trails off into the summer. Ragweed gets high in August, early September, and then grass comes out in early summer. So this told us, like I was saying before, that like not every day of pollen exposure is the same. Some days are going to be more intense than others, especially in the middle of the season. It becomes very, very intense. And with climate change, these peaks are getting higher, and also the spread of this like bell in the middle is getting wider. Okay, so what we find. Um, over all these years, there were 127,163 deaths in our data set from 2006 to 2017. 51.4% are female. Of course, that sort of reflects the general sort of percentage of males and females in the population. 88.9% were white, 9.4% were black. This is a little bit under, I think, the percentage of African Americans in Michigan. Cause category 61.2% were chronic lower respiratory causes, 19.9% were infectious respiratory causes, and 54% of respiratory deaths involved COPD in some way. Pollen patterns we've already talked about. I want to sort of speak to this 9.4% black. I think the population of African Americans in Michigan is a little bit higher than this. And what I want to point out is that in death records, recording is not all the same for all parts of Michigan and for all racial groups in the United States. Sometimes recording can be inadequate for Black decedents. And there's a whole literature about that this is an actual thing and why it's a problem and we just solve it. So what I'm saying is that this number here might not actually represent the true percentage of the population who pass from respiratory related events in Michigan. In reality, it could be much higher. Tree pollen was linked with a higher, this is what we found. We found that tree pollen was linked with a higher risk of respiratory death. And these are the pollens that appear in late winter, early spring, deciduous broadleaves, like our oaks and birches and these kinds of things, especially when levels were high in the week before death. About 80% higher risk during weeks with very, very high tree pollen of this kind. Ragweed pollen was also linked with increased risk, especially during the same day or day before. So what this told us in science, we can do some statistics and collect some data, do some statistics, and sometimes we find nothing. Like basically find no association between A and B. In this case, what we found is even given the sort of challenges of the types of data we were using, we found a signal that said these two things are at least somewhat related in some way. Is it the case that pollen is causing these deaths? We do not know that. There is an adage in science called correlation does not imply causation. Just because you see two things together does not mean those two things are necessarily causing one another. But we do see that these two things go together, and that merits extra investigation. So it could very well be the case that these pollens are significant contributor to mortality in these particular groups. It also might not. These things might be coming at the same time, and there might be something sort of in between and related. But at the same time, I think that when you see a result like that, it's worth having a conversation with your physician and sort of asking, I have pollen sensitivities, what can I do about it? Or I think that I have pollen sensitivities and I'd like to know, so give me a panel and we can find out. And that can be part of your, general sort of medical care. I think that's important. I don't want people to go away like scared of pollen seasons. But I think that it's important to sort of, be as aware of as many things as possible to protect your personal individual health. Ragweed pollens showed the strongest and most consistent link with deaths from chronic lung diseases. Ragweed allergies tend to be very, very intense in general. Ragweed is very common throughout Michigan, especially here in Southeast Michigan. And allergies are intense, so you're getting intense exposures all the time. And the symptomatic profiles like of an allergy reaction to ragweed are really intense. So this result wasn't really surprising for me in many ways, knowing that. For a person with asthma, or COPD or something like that, this can be a very serious exposure for them. And again, my intent is not to scare anyone. My intent is to say, well, if you do have COPD, or you do have asthma, it makes sense to have a sort of conversation with your healthcare provider to figure out, like the extent of your sensitivity, and also to figure out if there's anything you can do about it. I just want to make an aside. There are many, many treatments available for allergies of all different kinds. And one is, sort of, dealing with the symptoms, like your Claritins and that kind of thing, and taking ibuprofen or whatever when you have reaction. But there's also immunotherapy out there. You can get injections that are given, for example, at the allergy clinic here at the University of Michigan, that help prevent, like serious allergic reactions. And for people who have extreme pollen sensitivities, this is a real game changer for them. I did a study at the allergy clinic here at the University of Michigan, and I saw people come in that, had gloves on. This is the middle of summer. They had gloves on, they had a mask on, they had, goggles on, because their allergy and sensitivity was so intense, that they could not leave the house without covering every single part of their body. And they would come in for these immunotherapy shots to sort of, make their sensitivity less if possible. And I can imagine these people, feel like they can't leave the house. They probably feel extremely isolated, and can't do anything outside. And so it can be very serious. I'm not saying that everyone's like that. Everyone has a different level. But the immunotherapy shots can really help, is what I'm saying. We found no clear, consistent links with pollen and infectious respiratory deaths. Like influenza is very serious in older adults, which is why it's important to get vaccinated every year, as I'm sure that many do. So we kind of expected, to see something with this, but we actually didn't. And so that sort of suggests that either the timing of the flu season, the timing of deciduous broadleaf trees, pollen is different enough where they're not going to exacerbate each other. But it could also be just simply that there's no connection between these two things, like biologically. Men versus women found no strong or consistent differences. It was about the same. Black versus white, there was really no significant difference between these two groups in their sensitivities, in the associations of pollen exposure and mortality. Possible small trends, but nothing really statistically strong. So the big takeaways are that high short-term exposure to pollens, especially ragweed and tree pollen, can raise risk for serious outcomes. It's very possible. Does this study definitively say that? No, we can't say that using our methods, but it's very possible and something to be very aware of. The strongest effects seem to be for chronic lung disease and COPD. And we know that climate change is leading to longer pollen seasons and higher future risks. So this is something to be very aware of, both individually and as a society. Implications are that the more the better we all are. Better pollen forecasting and public health alerts are needed. So right now, pollen forecasting is fairly poor. Most of our pollen measurements come from monitors, which are sort of very few and placed in really not very helpful places. Like for example, there's a pollen monitor in Ann Arbor, which is fine, but Ann Arbor is a city, and while it does have some trees and some grass, it doesn't have nearly as much trees and grass as someplace like, for example, out in, you know, Manchester, or Adrian, or any of these like small towns, peppered throughout the state. So better problem forecasting in terms of where we're measuring would be good, and also just sort of better capacity, to warn people about significant pollen days would really go a long way to helping people be aware of possible risks. Um, Opportunities for clinical prevention. Diagnosis, I think, is very important. A lot of people with pollen sensitivities don't really know they have it. I didn't. I sort of figured it out, but I was never diagnosed throughout my lifetime. And that's why, again, I think it's important to have a conversation with your healthcare provider, to ask them, like, I get runny nose every August, do I have allergies? That's an important piece of information to know. Um, and also, speaking to the providers themselves is important for medical providers to be aware, that pollen allergies are definitely a thing in older adults, and to make that a part of their sort of like diagnostic and treatment regimens. Spreading the word about immunotherapy, I think, is important. I'm not a physician. I can't, recommend that you individually go and get immunotherapy, or anyone does, but I think it's important to like understand it exists and have a conversation with your health provider to see if that's appropriate for you. High risk groups may benefit from targeted messaging. So, for people with COPD, for example, I think it's important to let people know, like what I'm doing right now. This is exactly what I'm doing right now. I'm trying to like let people know that there could be a possible risk. And the more you know, the more you're able to take charge of your health. Future research should link pollen exposure with healthcare visits, medication use, and underlying conditions, so that we can get at whether these two things are absolutely 100% related or not. The more information we have, the more we can tease out the effects of these different exposures and outcomes. Okay, that's it. Y'all have any questions? Are there any questions?
Thank you so much, Dr. Larson. So if anybody does have any questions, please put them in the Q&A, or you can raise your hand and I can give you the option to unmute yourself. But while we're waiting for that to see if anybody has any questions, actually, it looks like one person does have a question. So I'm going to unmute you. Okay, so our guest, you should be able to unmute yourself now and ask your question if you'd like to do so.
Hi, thank you for this. This was very informative.
Awesome.
I was wondering, I have a sensitivity to carbon monoxide. It seems from the past, my doctor said I have hard time processing carbon monoxide, that different people have different, abilities to do that. And I noticed you linked either carbon dioxide or carbon monoxide with higher pollen count.
Mhm.
And I was wondering, is there a separate causation for high carbon monoxide in the air that day to the death count? Or did you look at carbon dioxide or carbon monoxide at all with the pollen counts?
That's a great question. And I wish I could provide you with a sensible answer. I think that it's a really, when we were doing this project, one of the extensions that we thought about making was like looking at pollens in the context of air pollution. So looking
Okay.
at like pollens and carbon monoxide, pollens and carbon dioxide, pollens and particulate matter exposure, and seeing if those two things like had a synergistic relationship. Like, for example, like if you have, like yourself, like you say you do, um, sensitivity to carbon monoxide, and you have sensitivity, to ragweed, those two things put together can have a multiplicative effect, possibly. And so, could make things significantly worse. So I think that's a really great idea. And, I hope that myself or someone else explores that.
Great, thank you.
Absolutely. Thank you for coming.
Yes.
Thank you, Marianne. Appreciate it. On that same line, what about, because I'm just wondering the last couple of summers that air quality has been so bad with
Mhm.
fires. Is there anything additional that you want to comment on that?
That, I mean, that really speaks to what Marianne was saying. Like wildfires on the West Coast and Canada, have made air quality worse in the summer. And last year, I think it came just about when ragweed season was hitting, I think. I can't remember. And, for me, that was just really, really quite terrible. So I think, being aware of these possible sort of synergistic effects of different types of, pollutants and allergens in the air and learning about how these things, can impact human health, I think is going to be really important moving forward, especially with, climate change increasing risk for wildfires and making things hotter and longer. And, it's going to be important to put all these things together. So we're not just always looking at only one thing in isolation from everything else. We're looking at many things together.
Thank you. Um, a question that I have, so I hear from people a lot that are hesitant to get allergy testing. And I know that you touched on this a little bit, that they may say, oh, well, what does it matter? What can I really do about it?
Mhm.
Can you speak to what you would tell to somebody who's on the fence of whether or not to get that testing done?
Well, knowledge isn't going to hurt you. Um, like, getting tested for, to see if you're allergic to something is not gonna hurt you. And obtaining that knowledge is definitely not gonna hurt you at all. Even if, in reality you feel like, there's not much you can do about it. Um, the reality is if you know that there's something, wrong, or, something about your health, there is something you can do about it. Could be something like as simple as recognizing when these symptoms happen and doing things like taking Claritin or ibuprofen to minimize your symptoms. I mean, something as simple as that can really help, and make your life a little bit more comfortable. In the extreme case, it could be something like, well, it's ragweed season, so I'm going to close my windows and turn my air conditioning on, to make sure that in my home I'm less exposed. That's like a really sort of low risk, low demand, thing that people can do to protect their health. But very importantly, and I think this is really the most important thing, is every bit of information you know about your health and every bit of information your healthcare provider knows about your health, the better they are to help you with an array of health conditions. The more they know, the better they can tailor your particular healthcare strategy to protect your health and keep your risk for serious events or just simply being uncomfortable low.
Thank you. Well said. So we do have one question in the chat. So Priscilla is asking, is there any resource that tells which pollens are prominent in what areas of the country?
Oh, wow. That's a great question. My answer to that is unfortunately no. There are some services that do these pollen warnings, but they don't tease out the different types of pollen. They just say, well, there's lots of pollen in the air. And that's a real shortfall, I think. And part of what we were trying to address in this particular paper is coming up with better systems of forecasting so that people actually know, what is the pollen composition of the air, in their location at that particular time. And that's just simply something we don't have right now. Um, would that be cheap to do? No, it would not. It'd be fairly expensive. But we monitor for things, all different other kinds of things, all the time, like, all their weather measures and that kind of thing. And so it's not impossible to do. It's just there hasn't been sort of enough awareness or that we should or will to implement those kinds of things.
Yeah, what do you think it would take from a public policy or legislature kind of standpoint for that to happen?
I think that what it would take is people recognizing this for the serious public health issue that it is. I think that, and this is me on my soapbox, right? I think that there is a tendency to sort of minimize the seriousness of pollen allergies. People are like, "Oh, you get a runny nose, like who cares?" And I think that's unfair. There are also sort of and anyone can, feel free to agree or disagree with me on this. Since pollen sensitivities are so much more prevalent in women than men, our healthcare system, is generally speaking, targeted towards masculine health, and women's health issues are often overlooked. And I think that's part of why, it's not on the list of priorities. Um, and then there's a general sort of, all of our other sort of, you know, um, unwillingness, I don't know what you'd call it, you know, because rural populations experience this, much more severely, and there's sort of like socioeconomic, differences in taking this very seriously. And then finally, the only thing I'll say, and last thing on my soapbox is that because these links between exposure to pollen and serious health events are not entirely 100% clear, policy is a little bit hesitant to do anything because, we want to put your money into things that are going to demonstrate results. And with this, it's a little bit unclear. So I think policymakers are a little bit hesitant, to do that as compared to some things that have, a sort of more like definitive or demonstrated, relationships, if that makes sense.
It does. So you mentioned, differences in sex and race and all of those socioeconomic. Do you also believe that this is not as taken as seriously because of ageism in
Oh
any
yeah.
way?
100%. Yes, of course. Yeah, absolutely. I mean, again, I don't mean to laugh. That's on I'm on my soapbox again. Yeah, I think I definitely think that. No, I mean, elder health is, you know, like, the complaints of elderly patients are sometimes dismissed by health providers, and I think that's true at the policy level as well. So yes, I absolutely think that, you know, our health system and our health priorities and our public health priorities, well, from a policy standpoint, from above, reflect our sort of general societal attitudes, towards specific groups, and so yeah, the answer to that, yes, I absolutely believe that.
Thank you. Okay. Any last questions from anybody? Okay. This was very informative for me. I learned a lot. Especially enjoyed hearing about some of your research studies and also the connection to mental health, I thought was really interesting as well.
Nice.
So thank you for taking the time. I know that with snow on the ground, that people may not be thinking about this as much, but now's the time to start thinking about the spring. Would you agree?
Yes, I know I am.
All right. Thank you so much, and thank you everybody for joining us today, and have a good day.
Thanks very much for having me. This was great.
All right. Take care.